Anyway, I want to welcome everyone to the final session of our health literacy series, Empowering Patients for Better Outcomes. This is the last in a series of 6 sessions. I can't believe it's June 23rd. It sort of snuck up on us. The series has been sponsored by the Finger Lakes Geriatric Education Center at the Ithaca College Gerontology Institute. And my name is Lisa Richards, and I'm the program manager for what we call the FLGEC, which is part of a geriatric workforce enhancement program at the University of Rochester. And the funding comes from the U.S. Health Resources and Services Administration, also known as HRSA. I wanted to let people know there are no CEUs associated with this last session, but feel free to introduce yourself in the chat to each other because it's always nice to make those connections. As the title slide says, the talk is going to be about Tech Allies for Health, increasing older adults' access to telehealth. We're going to learn about developing, implementing, and evaluating the Tech Allies for Health program, which is an intervention and tech training program aimed to increase older adults' digital literacy so they can engage in online healthcare and health-related activities. So I'm going to quickly introduce our 3 presenters, and then we're going to get rolling here. So we have Dr. Josette Rivera, who's an MD. She's a geriatrician, palliative care physician, and clinical educator at University of California, San Francisco. She directs the HRSA-funded University of California, San Francisco Geriatrics Workforce Enhancement Program, much like the one at U of R. And she is the founding chair of the American Geriatric Society Interprofessional Education and Practice Special Interest Group. She is recipient of several grant awards, including the HRSA Geriatric Academic Career Award and the HRSA Geriatric Education Center Award. She has developed programs and curricula to train faculty, students, and practitioners to provide optimal interprofessional healthcare for older adults. And we also have Alicia Newman with us, who's a PhD sociologist and the Associate Director of Evaluation and Planning for the HRSA-funded University of California, San Francisco Geriatrics Workforce Enhancement Program, GWEP. Her work focuses on demonstrating improved care and well-being for older adults and their caregivers. She does this through inter-organizational collaboration that provides educational and other interventions with health and human service providers, as well as patients, clients, families, and direct care workers. And finally, last but never least, we have Debbie Uchida, who is the volunteer coordinator at Little Brothers Friends of the Elderly in San Francisco. They are a nonprofit organization that provides social support for isolated older adults and programs that promote interpersonal connectivity with a focus on building trust, friendship, and community. Debbie manages volunteer recruitment, orientation, and participation for most of Little Brothers programs. She is also the program coordinator for this Tech Allies program that we'll be talking about today. So wonderful group. We're so excited to have them here. I'm going to tell you a little bit about how this is going to go. Dr. Rivera is going to talk about the need for telehealth and digital literacy training for older adults. And then Debbie is going to talk about implementing the Tech Allies for Health program, lessons learned. And then Dr. Newman is going to talk about findings from evaluating the program to date based on surveys and interviews with older adults and volunteer trainers. And we'll do a Q&A at the end. I think there's a plan to do a little bit of a Q&A at each of the end of the sections too. So if you have questions, we'll put them in the chat and we'll see how it goes. Maybe raising hand will work too. We'll just see how it goes. So I'm going to stop sharing my screen and I'm going to let Debbie take over sharing her screen.
Thank you so much. 1 second.
All right, so I'll kick us off. Thank you so much, Lisa, for the introductions, and welcome everyone. So glad to have you here. Very excited to share our successes and all of our challenges and lessons learned over the past year. So we'll get started. I guess for housekeeping too, as Lisa mentioned, we're going to have questions at the end of each section as well as at the end. Since there's quite a number of us here, please feel free to put your question in the chat. And the 3 of us are going to take turns monitoring the chat and answering questions as we can. So just put them in the chat and we'll try our best to get to them. So for learning objectives, we'll discuss by defining digital literacy and telehealth. So I'll be providing a brief overview and context of the problem we were trying to address. We will explain the importance of digital literacy to older adults and how it impacts their access to healthcare. And then, as Lisa mentioned, Debbie and Alicia will discuss the development and evidence for our Tech Allies program, which is an intervention of training for older adults. So next slide, please. Okay. So as Lisa mentioned, this was partly in collaboration and funded by the UCSF Geriatrics Workforce Enhancement Program, or GWEP or GWEP, depending on which side of the country you're on. It's federally funded, and just a brief overview, there are 48 GWEPs across 35 states and 2 territories. And the programmatic goals are to improve the health outcomes for older adults by maximizing patient and family engagement and integrating geriatrics, which is the specialized care of older adults, into primary care interprofessional teams. And we aim to do that by partnering with health systems, departments of public health, community-based organizations across our region, which is 9 Northern California counties. And we, in these partnerships, educate and train both healthcare and social service providers, all levels of health professions, trainees, direct care workers, and patients, families, and caregivers. So that's our program in our context, and Debbie will describe Little Brothers Friends of the Elderly shortly. Next slide, please. So I'm not an expert in digital literacy or technology by any stretch, but I am a geriatrician, and I provide primary care solely to homebound older adults in San Francisco. So these are older adults who, for cognitive or physical reasons, cannot leave their home. And I have witnessed the profound impact of the digital divide on both my patients and in my personal life. So here's a personal anecdote that occurred a few months ago. I'll share with you. My father lives alone. He's about 3.5 hours south of me in a home, his own home, without internet service. He had internet, it broke, and for some reason, no one can figure out how to fix it. So he was trying to sign up for a COVID vaccine appointment by his smartphone, but the formatting and the font was small, and he thought he was touching all the wrong buttons. And then he tried to call the helpline and was directed through a long menu of options. But as his hearing is very limited, he couldn't hear which option to select. So I reached out, I went online. I also found the county website to be very hard to navigate. And ultimately, I ended up signing him up through a retail pharmacy website. And so I suspect that I'm not alone, and maybe some of you have also had this experience helping others. And this experience also aligns with the CDC study just in May 2021 that reported that those over 75 were less likely to be vaccinated due to barriers such as this, including lack of internet access and no one to help them find an appointment. Next slide, please. So although this presentation focuses on the technology gap separating older adults, I do acknowledge that a digital divide exists for others as well, such as those with lower levels of education and income. As recently as 2017, 1/3 of older adults over 65 have never touched the internet. That leaves about 2/3 who have used it to varying degrees, and this has increased to about 75% in 2021, likely or maybe partly due to the pandemic, but this is compared to 96 to 99% of users in all other age groups. Next slide, please. And as many know, older adults are the fastest growing age group, both locally and nationally. Aging in San Francisco reflects trends across the United States. Nearly 30% in SF will be over 60 by 2030. And also, I want to point out, nearly 30% of older San Franciscan adults are living alone. And so I think the digital divide is likely to increase in scope. Next slide, please. I wanted to include this slide to illustrate that the digital divide is a very multi-layered, complex problem. And pictured here is a framework based on a literature review of global literature that categorize different contributing factors. And I think what it highlights is it's not just a matter of access, It's a matter of many other things, including infrastructure, socioeconomic status, knowledge and skills, attitudes and culture, and so on. Our pilot program tried to address access and literacy, so we'll focus on those next. Next slide, please. In terms of access, as of 2020, 36% of older adults do not have internet access at home, and yet many value that. Surveys show that older adults do place value on the importance of this access, saying it's either essential or important, which is on par with all other age groups. And initially, this was seen as a rural problem for which the solution has been to build infrastructure in remote, underserved areas, which does make sense. However, a study in 2019 looked at the problem differently, and instead of looking whether the infrastructure exists, they asked who actually has it in their homes. And when you look at it through that lens, they found that 5 million in rural versus about 15 million in metro areas did not have broadband, which raised the issue of affordability. So affordability plus infrastructure are very big determinants of access. Next slide, please. In terms of literacy, San Francisco City and County has a digital equity strategic plan in which they define basic digital literacy, and that's the definition that we've used. And so basic digital literacy is the ability to search, find a website, send email, and fill out an online form. Next slide, please. In San Francisco, 40% of older adults do not have these basic digital literacy skills. And this aligns with the Pew Research survey a few years ago that 75% of older adults who do use the internet need someone else's help to set it up or to set up their devices. 34% have little or no confidence in their ability to use devices at all. Next slide, please. So this slide sums up the issues of access and literacy in our city, broken down into different demographics, but you can see here for 65 and up, which I've highlighted, about 60% have internet and some basic digital literacy, the rest do not. The only other lower demographic is those with less than $25,000 a year income. Next slide, please. I also wanted to focus on or consider factors around attitudes and culture, which I think are particularly pertinent to older adults. So some older adults might have a lack of confidence or fear in using technology, but older adults are a very heterogeneous population. So some may have internalized ageism, some may truly just not care to learn about it. But many do want to engage and learn. And once older adults are online, evidence shows that they engage at very high levels. A different Pew Research study showed that 75% of internet using older adults go online daily. 58% believe technology has a mostly positive effect on society. And a different survey showed about 21% expressed very strong preferences for being early tech adopters. So very, very positive attitudes and engagement. On the other hand, I think ageism is at play, and that's manifested in many ways, including the ways that technology is marketed towards youth, and that most devices and apps and most of the technology and all the social media things are not designed with older adult input. Next slide, please. And during the pandemic, the internet, has been indispensable to millions of Americans, people around the world, particularly during the shelter-in-place orders. The internet has been a way to see family and friends and stay connected, to learn new things, to order food and medications. And in terms of medical use, there was a 154% increase in telehealth visits the last week of March 2020, which is around the time we started, during the implementation time of our pilot program, versus the year before. Health information and test results are usually relayed by email or electronic medical record. We saw that local, state, and national governments relied heavily on websites and social media for their messaging and education about COVID vaccines and all things COVID. And as I talked about earlier, vaccine appointments are mostly online. Next slide, please. So a little over a year ago, in the spring of 2020, AARP conducted two telephone surveys, each of about 2,000 adults, about a few months apart. And they found that adults over 65 who envisioned using telehealth more widely cited a lack of access to high-speed internet and computers, about a third, and a lack of knowledge on how to use telehealth, about a half. However, they found that comfort with telehealth might increase as the usage increases, which makes sense. So among adults who had used telehealth services in the month prior to the second survey, 85% said they were more comfortable and they would use it to do things like renew prescriptions, and 75% said they would use it for routine doctor's visit moving forward. So to help address the low levels of access and digital literacy among older adults in San Francisco, in the context of the pandemic and shelter-in-place orders and the consequent and urgent need for telehealth, we conducted a pilot program, which Debbie will now describe. But before we move forward, maybe I will check and see if there's any questions for me in the chat. No, are we good to go? Great. Okay, Debbie.
Anything at the moment.
Great. Thank you so much, Debbie. Take it away.
Thank you so much, Josette. Let me see here. So hello, everybody. Thank you for joining us today. And if you missed it early on, my name is Debbie Uchida, and I am the volunteer coordinator, as well as the Tech Allies Program coordinator at Little Brothers Friends of the Elderly. Little Brothers Friends of the Elderly is a national nonprofit, volunteer-based organization committed to relieving isolation and loneliness among the elderly. We offer to the people of goodwill the opportunity to join the elderly in friendship and celebration of life. So we were founded in Paris, France, back in 1946 after World War II by a lovely nobleman by the name of Armand Marquise. And if I butchered that pronunciation, I apologize. Basically, he was, he loved to give back to his community. And at a very young age, he and his grandmother, would give back to those that were less fortunate. So he was exposed to poverty at a young age. And after the war ended, he saw there was just a huge need to serve folks that were left poor after the war. Especially the elderly community. So he decided to gather a community of young Catholic laymen, and they were known as Little Brothers of the Poor. And what Little Brothers of the Poor did was provided visits as well as flowers and meals to those that were in need. His motto was flowers before bread. So as you can see, our logo does include a rose. Flowers represent friendship. And so he really did believe that it was just as necessary to nourish our souls with friendship as it was to nourish our bodies with food in order to live. And so we did carry that motto moving forward in all LBFE chapters, basically. LBFE came to the US in 1959. The first chapter to start in the US was in Chicago. San Francisco's chapter started on Christmas Day, 1990. So we've been around for quite some time. We are now in 7 different US cities. So of course there's Chicago, San Francisco, Boston, Cincinnati, Minnesota, Upper Michigan, a chapter information as well in New York. And we are also in 10 countries worldwide. So again, we were founded in Paris, France, but we are also located in Germany, Ireland, Spain, Canada, Romania, Switzerland, Poland, Mexico, and of course in the US. And so we all share the same mission. We all just deliver programs differently, really depending where we're at, but we are each our own independent organization as well. So just to be clear here, LBFE, we are really in no way, shape, or form specifically held to teaching digital literacy skills. So all of the programs we offer are really geared to provide social support as well as to reduce isolation. So pre-COVID, everything we did was in person. We would provide monthly and home visits with volunteers and older adults. We did birthday visits, we had social gatherings. We provided a program that was a medical escort program, so providing free transportation to our older adults to get to and from their medical appointments with the accompaniment of a volunteer. We also offered special excursions, going out into the city together, as well as a visiting volunteer program, which was a long-term friendship that, we had volunteers matched one-on-one with an older adult, visit twice a month for a year's commitment, so that there's really that time to build that trust and rapport. Of course, during COVID, all of our programs did have to shift to become remote. And so we began to offer grocery and prescription assistance, where volunteers would go out and do the shopping and do a contactless delivery for our older adults, simply because we didn't want to put our older adults at risk in getting into the bus and to the grocery store and all of that. We then also offered weekly phone check-ins with volunteers to call an elder on a weekly basis just to see how they're doing, check in and have a friendly conversation. We offer a ride program where we are able to schedule Uber rides to and from medical appointments for our mobile older adults. And so we were lucky enough to have an Uber grant through that. And then of course we have our Tech Allies for Health program, which I will dive deeper into in the next few slides. So the program development, we offered a Tech Allies 1.0 program, if you must, early on in about, I want to say summer of 2017. And this was really just to teach our older adults who were not connected to the internet, teach them how to connect to the internet and what they're able to do on the internet. So with this, it was an 8-week program where we were able to provide a program and bring a training program to the older adult in the comfort of their own home, which was one of the most unique things about our program. It was offering that one-on-one mentorship. For those that did not have internet connection, I did help them get set up with a program called Internet Essentials through Comcast. It's basically an affordable internet plan for $9.95 a month. And so with that, we were able to provide LBFE was able to cover 3 months of their service. We were able to provide them 2 months of training with the volunteer, and then really just an iPad as well. So they were able to have a device, have internet, as well as that one-on-one undivided attention from their volunteer trainer. With that program, we knew 8 weeks is not enough to even touch the surface of what you're able to fully do on the internet, let alone learn a new device. And so we always thought we need to continue this program, maybe a 2.0 of some sort. And so that's where this discussion came into play. What will the Tech Allies program moving forward? What will that look like? Of course, when the pandemic happened, we knew right away we need to provide this program that is geared specifically towards health-related activities, as well as getting folks connected to telehealth. And so I want to say, beginning of COVID, around March through July or so, we were meeting with UCSF, I want to say maybe on a weekly to bi-weekly basis for months, just to discuss what would this curriculum look like? What do we want to focus on? How can we deliver this program remotely? Of course, I was terrified to do that because we've never done remote programs like this, let alone teaching somebody how to use a digital device remotely. But of course we managed, and with the help of Community Tech Network, CTN, they helped us to package that final curriculum and to really be able to provide the physical booklets to our older adults as well. In continuing the program development, of course, there's a lot that goes on behind the scenes before we can even launch the program. So we had to consider what devices are we going to use and what is the best way to prepare these devices, because I physically could not be there to set up the devices in person. a volunteer couldn't physically be there to troubleshoot any of the issues. So we used a company called E Squared, and this was a company that was recommended through CTN. So they were also the ones to help us in communicating with E Squared and figuring out the best way to set up these iPad devices. So E Squared helped us in refurbishing iPad devices that I think were 5th generation. So they weren't the latest and greatest, but they were definitely an upgrade from the iPads we provided in Tech Allies 1.0. In preparing these devices, we knew there would be issues of folks forgetting their Apple ID login information, maybe forgetting their email address. And so to avoid all of that, we decided the best way to go about this is to create generic email addresses and Apple ID that's already pre-set up. I have all the passwords and all of that that the older adult and the trainer would need. And so that was kind of the workaround to avoid me having to even try to go into in person to an older adult's home. And we pre-downloaded apps as well. So we included Gmail, Zoom, YouTube, and Google. We always throw in YouTube there because it's just a fun thing to do. It's a nice distraction, especially if our older adults were just isolated at home. We wanted to be able to also provide a way for them to do something new or watch some videos or watch something fun. So my duties as the program coordinator for the program was to recruit older adults and volunteers. And so what I did with that was I reached out to every older adult and volunteer that participated in the first Tech Allies training program, just to gauge interest, to see who's interested in this next step. It was a hit or miss. Some people really felt, you know, I'm okay with what I've learned. I'm able to do just that. Other folks already connected to their doctors online. And of course, some folks have already passed in that time frame. So I had to recruit, of course, those that were in the 1.0 program as a priority because they did complete the program and we wanted to upgrade their devices. And then, of course, we just went ahead and reached out to all the older adults in our database who are connected to the internet and had some knowledge of how to use the internet already. We did provide the iPads as well as a physical curriculum booklet, and those were delivered by our director personally. She did contactless deliveries for all, I want to say about 43 iPads. And the reason why we decided we needed to do these deliveries in person was simply because the fear of the device being lost in the mail, packages being stolen. And so this was just the best way to work around it. And so without her, we would not be able to do that. And then on my end, I also had to help the older adult connect their device to their Wi-Fi. And of course, I could only do this over the phone. Some people were able to get it right away. Others, it could take anywhere from an hour to 2 hours to help them set that up. Aside from that, I also trained the volunteer trainers. And so I'll kind of discuss the model we used and why. But then just throughout the entirety of the program, troubleshooting any issues that may come up with their device or their Wi-Fi. You know, I am the go-to person for volunteers and older adults to call in regards to anything iPad related, anything Tech Allies related. And so that is definitely something that would be needed in this program, somebody on call to be able to do these things. And then we would keep track of sessions for the sake of evaluation. So I did create a volunteer feedback form where volunteers would log every session onto this form, let us know, hey, you know, we're reaching the 7th session, and more so for me to be able to let UCSF know that, hey, they're about to be done. You can evaluate what they've learned after their program, but also a way for us to understand what challenges came up during their sessions, what worked, what didn't work, and how can we improve moving forward. And so then program structure, our goal with the program was really to train 50 older adults in teaching them how to access telehealth from home, how to connect to their patient portals to be able to communicate with their doctors online, as well as how to use video calling, both for health as well as for socializing. So again, The population LBFE serves, they are isolated and lonely older adults. A lot of them depend solely on our programs and our volunteers for that socialization. So of course, when COVID hit, it was a huge issue of, a lot of people felt even more isolated than they did before. And we wanted to find a way of how can we include people in virtual events, or how can we get older adults to feel like they're doing a visit and seeing another person's face. Phone calls are great, but they can only go a long way, or such a long way. In order to be eligible for this program, the older adult must be enrolled in LBFE programs. So we did not offer this programs exclusively. We wanted them to also be involved with our weekly phone visits, or maybe grocery assistance and things of that sort. Simply because sometimes it would be the case where it's like, I just want a free iPad, and that's not what it's about. We also wanted to make sure that they had Wi-Fi connection at home. Again, because it kind of ties into having prior knowledge of how to use the internet. The way this curriculum was set up was not necessarily a beginner's level curriculum. So we really wanted to be able to kind of make sure we have the 7 sessions set and not take too much time in teaching them how to just use the internet, which is the Tech Allies 1.0 program. And they had to be English speaking, just because we did not have the curriculum in any other language yet. So that was kind of the eligibility there. And the train the trainer model is what we used. So what that means is I would train the volunteer trainer to train the older adult. And what we did there was the volunteers would do an online pre-training where they basically get videos to see tips and tricks on how to work with older adults and teaching them technology. They would also ask questions to kind of get that hamster wheel rolling. How would you explain to somebody who's never done this in their entire life, let alone they don't know what this is, how would you explain how to make a cup of coffee? And so that kind of makes the volunteer trainer think more in terms of how would I explain something? Maybe they don't know what a grinder is, right? So things like that. So they would just kind of use that example in teaching their older adults as well. How would I explain the internet? How do I explain Wi-Fi? How do I explain what an app is? Once they complete that pre-training, we would do a one-on-one Zoom training, me and the volunteer. I tried to do group volunteer trainings, but of course it was just hard to get everybody on board at the same time for a Zoom session after work hours. So I would just move forward and do one-on-one sessions and just go over the curriculum, do a run through of the curriculum, ask questions, or answer any questions that volunteers may have before they actually begin training their older adult, and just discuss best practices. What are things to keep in mind when training older adults? And I will share also some of those best practices. We decided that the program is going to be 7 sessions, also knowing that, 8 weeks wasn't enough in the first program, but 7 sessions is a lot of information to kind of teach our older adults, right? So we wanted to do 7 sessions, roughly looked like 7 weeks, once a week sessions of one-on-one remote training. We provided a learner's booklet for the older adult, which is a curriculum. We provided the refurbished iPad, as well as a stylus pen and iPad case. I think these 2 things are actually very important that we didn't even consider to begin with when we delivered the first set of iPads, and then we realized we need to get those pens and we need to get the cases. A lot of our older adults have shaky hands, so maybe the touchscreen option isn't necessarily ideal for them. So the stylus pen would work well, as well as an iPad case, so they don't have to hold the device the entire time. There's the fear of dropping the device, so this way they could just prop it up and just keep it at their table. And then we would provide a trainer's booklet for the volunteers, which was identical to the learner's booklet. They just had little tips and tricks on the side of each lesson to kind of help them and guide them through the training. So as I mentioned, I wanted to share some best practices here. This is something I go over, and they're the 8 principles in working with older adults and technology. And this is something I always stress in my volunteer training. It's important to note that the learner is in control. Even though we do have these 7 sessions laid out in a 7-week curriculum, it was important for me to let the volunteer know that the older adult will set the pace of the program. Everybody learns at a different pace. We don't want to overwhelm the learner, and we don't want to overwhelm the trainer. So that is very important in training older adults. Of course, you want to be patient with the learner. If you're a teacher, you just have to have patience. Get to know the learner. That's also an important thing to know, because you want to understand their motivations, and that will help to keep them engaged in the program. You do not want to assume knowledge. So even though eligibility is for this program is to have prior knowledge of how to use the internet, that does not mean that our older adults are tech whizzes. That's not to say, you know, they know everything or we know everything. So do not assume knowledge, just kind of meet them where they're at and then go from there. Admit your own limits, and this will be just to keep this number 5 in mind when Alicia speaks about one of the quotes that our older adults had. Admit your own limits, because there's certainly things that I myself don't know, and I don't know how to answer sometimes. So I always say, let me do some research and I'll get back to you. Be respectful of differences, of course, just learning differences and just realizing that, you know, our older adults were not born into the internet like some of us were, let alone when they worked their jobs, their internet did not exist. So be respectful of that. You want to be selective and focused. Of course, this is important to make sure that you're not wasting an hour of your day teaching an older adult this lesson that they do not care about. And then you want to be so flexible and creative. So in the next slide, I'll do a little curriculum overview. And so this is just the curriculum at a glance. These are the 7 sessions we decided on. You can see that the first 4 are with a little asterisk, and that's simply because we knew that anything could happen during this program. We may have dropouts, we may have people who are just overwhelmed, because each of these sessions were very jam-packed with information. We knew 7 sessions may not be enough to even absorb all this information. So what are the top things we want our older adults to succeed in the 7 sessions? That was reviewing the basics, just getting a refresher of their new device, because again, even though it was still an iPad, the way things work, the functionality kind of changed a little bit from their first iPad. So reviewing the basics, getting familiar with all of that again. And then we wanted to focus on video conferencing again, because of using Zoom for telehealth appointments, as well as socializing, and then setting up their patient portal online. You can see that those are broken up into 2 sessions, because again, it's a huge lesson to learn. So the first patient portal part 1 was creating that patient portal account. And then patient portal part 2 was to navigate through the patient portal, learn how to email your doctor, learn how to view prescriptions, things like that. And then of course, if they were able to get that far, then, you know, session 5 was helpful health information websites, reliable health information websites. 6 is useful health related apps, things like nutrition tracking, brain fitness. Some people loved the meditation apps. And so that was something great that they can do, and it kind of makes it a little bit more fun, right? And then there's the advanced care planning, which is the last session. If they already had that handled, then maybe it was just a way for them to wrap up the program, review everything that they did thus far, make sure that everything is up to par, and then they could do something fun together. Some of the volunteers, you know, we did ask them for a 7-session commitment, but some folks decided, I really hit it off with my older adult. Can I please continue this friendship? Can I just kind of teach them things outside of the curriculum? In that case, that's the ideal situation. And so of course, I would never say no. That not only, you know, breaks up, we did not want to break up a friendship that had already started. And so it just kind of works out for the best when it turns out that way. And so challenges in the program. And I do apologize for my wordy slides here, but we did have the expectation of having one session per week. Of course, we knew that wasn't necessarily going to happen because in the past, there were always scheduling conflicts, and that's something out of our control. There may be cancellations or dropouts due to health-related issues. And that's something we did see a lot of, a lot of our elders too were very fearful with COVID. So anything COVID related, any update, that was their priority as opposed to learning this program. We also had availability changes. So volunteer trainers, maybe they had to move out of the city and then start a new job where their workload was way too much. Sometimes, just anything can happen. So that was one of the issues as well. So then that 7-week expectation could have turned into 10 weeks. That could have turned into 12 weeks. So we just had to be flexible there. Burnout due to workload, that was something I definitely saw with the volunteer trainers. A lot of people managed to teach an older adult how to use the internet while being completely overwhelmed with work. So our volunteer trainers were definitely key in this entire program and just so great. But if they did feel burnt out, they did drop out, and that was okay because we were able to find volunteer trainers to replace them. And then older adults would disappear and reappear after some time. And so what I mean by that, there's just one story where we had an older adult. She had 3 sessions with her volunteers, so she had 4 more to go, but then she just dropped out of basically the face of the planet. We couldn't find her. Her phone was not, I left tons of messages. I wrote her emails. I did everything, tried reaching out to emergency contacts. So I started worrying and I was like, I hope she's okay. Months later, she reappears and then she's like, the issue was that, and it's embarrassing for me, but my financials weren't there. What I had to decide on was, do I pay my internet bill and my phone bill, or do I pay my electricity, my PG&E? So of course, these are things to kind of keep in mind, and it ties in with Josette's point about affordability and access. And so we do serve a lot of older adults that live below the poverty line. So that's just kind of something to keep in mind as well, that it's not, even if it's $9.95 a month, sometimes that's a financial struggle for our older adults. COVID-19 was a huge challenge, just kind of working with COVID-19, finding ways to do this program remotely and just kind of work with all the changes that were happening in the past year. Wi-Fi for getting passwords and login information. I don't know that this is something we will ever get past. I try to tell our older adults, in your booklet, there's a specific place for you to say, this is my password, this is my username. But again, it just depends on the older adult. Prepping the devices remotely, troubleshooting things remotely is always a challenge, but it's doable. Recruitment was a bit challenging. Again, you can see that our goal was 50 older adults and we were able to recruit 43. It was very interesting, of the English speaking older adults we have in our database, it's probably about 150 to 200. And so calling all those older adults to explain this program, to see their interest in the program, it was interesting to know that either they did not have internet connection and had zero interest in getting connected, or some people that did have it already were connected to their doctors, therefore they weren't eligible. Some primary care providers did not have a patient portal set up yet. So that happened maybe about 2 times for some of our older adults, where they were still figuring out themselves, how are we going to do telehealth? So that was kind of a little struggle, because then our older adult was not able to move forward in creating their patient portal. And then older adult living situations. Everybody lives in different living situations, and not everybody lives in assisted living. So there were definitely things, depending who they live with, maybe there was some mental or emotional abuse where they felt they did not want to continue with the program, or that they had to put a pause to take care of their mental or emotional health first. Destruction of property. There were instances where some people had somebody come in, disrupt their entire property, maybe steal the iPad devices, stealing the learning materials, or just losing them. We also had an instance where an older adult, he had magazines, and so in between those magazines had the iPad, and he did not realize, he just threw it away. And so it's different living situations, whether they're clean, whether they're messy, whatever it may be. That was also one of the challenges. And then lessons learned. Every older adult learns at a different pace. That is key here. Flexibility is necessary when working with a vulnerable population. Again, our older adults can get very sick out of nowhere. They could be great one day and sick the next day. So we just asked for flexibility in the volunteers, as well as the older adults in the case that the volunteer is not able to meet for one session. Screen sharing is crucial for remote learning. They started the program, the first couple sessions, over the phone, explaining things. And if the volunteer trainer didn't have the exact device, then they were kind of just trying to figure it out with the older adult based on pictures. So there's different interfaces on different devices, whether they use a tablet, smartphone, or computer. So that was something that the volunteers also had to adjust in their trainings. Is I'm using a computer, but it looks different on my end than it does for the older adult. 7 sessions was not enough training. Of course, we knew that with the 8-week program we had prior, but that is why we want to continue offering this digital literacy training support moving forward. So just keep that in mind. And that was definitely like 80 to 90% of the feedback from our older adults is 7 sessions is not enough. And then without the Tech Allies for Health program, many of our older adults would still remain virtually trapped in their homes. And that is definitely something many of our older adults expressed to me. They mentioned that, the uniqueness of having that one-on-one mentorship really means everything to them, because then they don't feel rushed as they would in a computer class. They are able to ask questions and really get that attention that they need. And definitely being able to get a device through this program, as well as low affordable internet. So without this program, we know it works. It's definitely worked for our older adults. And so we do hope that we're able to put this out there so more organizations are able to offer something similar. And then I am done here. If anybody has any questions.
I think I see 3 questions in the chat. One Kathy kindly answered. Maybe I'll just put them out there, and Debbie, Alicia, Kathy, we can all sort of answer them. If you're not monitoring the chat, this was one that was answered from Nicole. Was that Comcast that offers an affordable monthly rate for internet? And Kathy answered, that is Internet Essentials Comcast and AT&T. Kathy, if you want to add anything to that.
And just so everybody knows, Kathy is our executive director at LBFE, and she is here as well.
My apologies, Kathy. Should have introduced you.
Hi, everyone. Yes, so I think it's a national program. And so Internet Essentials, that's what it's called, is $9.95 a month. And every Comcast division or sector has somebody in charge of Internet Essentials. So the person we worked with worked in the Bay Area. So I believe you can just call Comcast. Good luck with that, though. And then you can find out who that representative is.
Yeah, so I would also mention that Comcast Internet Essentials is offered to kind of specific locations. So if somebody lives in a higher end place where it's not so much low income, you may not be eligible. So there is a way on the Comcast website to input that address to see if their area is serviceable.
Thanks, Debbie. That's super helpful. The next question from Lynn is, for the website module, do you talk about how to assess sites for medical information?
For the patient portal, is that?
No, I think it's, Lynn, correct me if I'm wrong. I think it's to assess the credibility of the websites.
Yes, it seems to me like a lot of the seniors that I know fall for a lot of information that they see on the internet. So do you help them to assess I guess, the truthiness of sites?
Yeah, so one of the things we talk about in that curriculum is, that there's fake websites out there. So we always try to make sure, one, that they're in a secured website, but two, we just kind of went with Medline Plus as well as UCSF's website, which we knew were reliable resources. And so medlineplus.gov, great website. And so that's kind of what our older adults stuck to. But we did have a little section where volunteers would kind of say like, this is how you can tell if things are a scam, or don't believe everything basically you see on the internet. So they would really refer back to medlineplus.gov. Sorry if that did not answer your question.
So it sounds like you directed them to a couple of website or a few websites that we vetted, and then sort of went over issues around credibility. And I think Alicia's going to talk about in our lessons learned a little bit about things that we would like to add to the curriculum moving forward that more robustly addresses the issues of online safety and assessing the quality and credibility of websites. So we did a little bit of that, but I think we need to do more.
Yeah, and definitely I will say in the Tech Allies 1.0 program, we did have a lot of lessons about internet safety. And so that's something we definitely want to think about in next steps as well.
And the final question comes from Andrew. It's kind of long. So Andrew, I want to invite you to share your question with the group if you like.
Okay. I know I'm long-winded. Can you hear me?
Yes, thank you.
First of all, really quickly, I don't have the link at hand right now, but when I was at the WHO, we developed some tools to evaluate websites. Beyond going back to the National Library of Medicine, they're online. You can find them if you search long enough. WHO websites being. So anyway, here's my question. So far, for the most part, and I'm not being critical about this, I'm just making an observation. You all discussed age and health is pretty generic, right? If somebody's older, they're less likely to use the internet and associated tools. And if they're not healthy, they're less likely. But there's a huge difference between, let's say, a quote unquote elderly person who has physical disabilities and someone who has dementia. And their ability to use these tools and their goals of using these tools are going to be dramatically different as well. So what it boils down to, my question is, in your experience, where do you think the biggest bang for the buck for an intervention is going to be? All right, how can we target this to get the most out of it, which is going to keep funding flowing because we can prove greater success, right? And then get to the sort of edges. But like I know a couple 80-year-olds here in Tucson who use the internet better than most 40-year-olds I know. I kid you not, right? So why would I target them in an intervention?
Yeah.
And who would I?
Yeah, so I do want to say that we don't necessarily, somebody could be 65, somebody could be 90, and then the 90-year-old can learn much quicker than the 65-year-old. So that's definitely something we know. We don't assume that just because they're older, they're not necessarily capable. In terms of working with folks that, let's say they had dementia, then that's a tricky one because then it would be just longer sessions, more one-on-one attention, definitely more than 7 weeks. So just continuous training, I would say, for them. But I'm not sure if.
Yeah, but see, I mean, I've lived through this personally. There's no cure for dementia.
Right.
Which way it's going to go. So why wouldn't it be more cost effective to just assign them a helper? Period.
I'm sorry, Andrew, you were sort of breaking up. Wouldn't it be more cost effective to assign them a what?
Let's say someone with dementia, but I could think of some other examples. Just assign them, if you got volunteers, just assign them a helper, right? Who's going to go in for X hours a day and get done all the work that they need done.
Mhm.
Yeah. So,
That's exactly what we're doing with their food and their personal hygiene.
yeah.
Yeah.
Yeah. Go ahead, Josette.
Well, I think we all have answers to this question, or not. Let me rephrase that. We probably don't have any answers to this question, but
Exactly.
a lot of reflections and thoughts. So I'll start by saying I don't think we have the answers, because this is really an emerging and neglected area of research and of pilot programs, of interventions. I mean, we looked around the country to see who else is doing this, and really very few. And I agree with Debbie to the initial point that I made earlier, that as we age, we become more different. We're an extremely heterogeneous population. So if you've seen one 80-year-old, you've seen one 80-year-old, and you cannot make any assumptions of their physical or cognitive abilities based on age. So I want to be clear about that we are talking about older adults because the research talks about people over 65. And even that is problematic because they're lumping everyone over 65 into one giant category. And it's not necessarily, that's not even necessarily the case, but that's what we have. And so there are extreme differences at every age in terms of abilities, interests, and motivations. So your point is very well taken. I agree. I mean, my own personal reflections are that we likely would not get what you're saying, bang for the buck, for people with cognitive impairment who cannot, whose likelihood of being able to continue to engage in this as the technology evolves for all of us. We will, the training, we would likely not be able to sustain that. That would be probably diminishing returns as we know the course of the disease runs. It varies for people. But for me personally, I would target people who do not have cognitive impairment, for one. In terms of health or abilities, again, it's so heterogeneous. And with that reflects their motivations and why they would do this. I think for us, what made sense for us and what aligned with the mission of LBFE is people who have no one else to help them, who are in the program by virtue of social isolation and the subjective feeling of loneliness. And so this program tried to connect them to alleviate those issues, as well as helping them access their medical care and so forth. So that's where we started, with people who had no one else to help them. You might consider that, I'm thinking about my patients who live alone. It's kind of a similar thing to your point. They may have helpers who come in and help them bathe and help prepare their food and meals and so forth. I would love to see programs that would help them, connect them with technology. That's a different approach. But I think we were trying to go with people who could engage and who had no one to help them. And I would love to see more research and more pilots in this area so that we could begin to tease this out and target the populations a little bit better. That's just my sort of off the cuff remarks. And Debbie, Kathy, Alicia, please weigh in.
Yeah, and in addition to that, the reason why we don't do that with our organization is our volunteers are not helpers. They're not social workers. Our volunteers solely provide friendship and companionship. That's really the mission of our organization, and all of our programs are geared to that. Yes, we did assist with grocery assistance and prescription assistance during COVID, but before that, we never offered those types of things. That is where social workers or, caretakers and all those things come into play, where we're not that. So that's why we wouldn't necessarily be able to help someone with dementia to just get them help, but we can certainly refer them to get help or contact their social workers to make sure that they're aware to get them that help.
And also, to be eligible for our program, each older adult is assessed and they go through a loneliness screening, and also they go through a cognitive screening. So if they cannot have like a conversation and follow conversation, it may not be a good fit for our program, because we are building friendships, reciprocal friendships. So we may then refer that older adult to another agency that has support programs for cognitive decline. So we certainly will follow, and somebody, as you know, in the aging process, we may get an older adult at 65 and that we're still serving at 95, and there is cognitive decline through those years, but those folks can continue in our program. But we would not just take somebody in our program that has cognitive decline right away, and maybe the Tech Allies program for health would not be a good fit for them.
Yeah, I know I picked the two extreme examples, but I did it on purpose.
Good.
I know people in their 50s who have physical disabilities that I would consider them elderly. Right? They're not past 65, but their whole life is essentially an elderly lifestyle.
Mm-hmm.
I would just encourage everybody who works in this area. That way to answer this question is to ramp up your baseline evaluation.
Well, that sounds like a great transition to our evaluation section. Does anyone have a pressing question that can't wait until we get through what we have found out about the program? I want to, Josette, I think that was exactly what I had hoped to say, that there is so much that we still don't know. And what I can share with you now is what we have found out so far with this small pilot program of 43 individuals. Does anyone have a pressing question before we move on?
I see just one last one, if we may, to just wrap that up from Chris. It says, you mentioned how training is delivered to elders in some of the hot spots needing more time and training. Do you have a top 3 that were consistently seen across the board, and how did you manage these, or how do you manage these?
Sorry, I was trying to figure out how to unmute myself. Can you please repeat that?
Sure. It says you mentioned how training is delivered to elders and some of the hotspots needing more time and training. Do you have a top 3 that were consistently seen across the board, and how do you manage these?
Can you further explain that, Chris? I'm sorry if I'm not understanding.
Do you mean the top 3 lessons that took the most time or were the most difficult?
Is Chris on?
Chris, if you're talking, you're muted.
Sometimes people can't unmute too, so why don't we give it another couple seconds?
Okay. Sorry for not understanding that question.
Oh, he's having tech
issues. Maybe we can come back to it.
Yes, maybe Alicia, go ahead, and then we'll circle back to that. Thank you.
Great. Okay. All right, thank you. Hi, my name is Alicia Newman. I'm the Associate Director of Evaluation for the GWEP at UCSF. And it's just been such a delight to be a part of this program. I'm going to talk to you, as I mentioned, about what we have found so far. The evaluation is still ongoing. We are collecting information from both older adults and our volunteer trainers. And for the older adults, data is collected before and after training, and then again 3 months later. And we have just started the 3 month later part of the program. So what I'm going to be presenting today is from our baseline and then post-program training. We are collecting information through both surveys and interviews, and we're focused on some key metrics. we're really interested in whether there is change in frequency of use of the internet. We're looking at, we're using a Likert scale, and we're looking at, do they use it never? Do they use it daily? And that range. And then we're also looking at their confidence in engaging in some key competencies, specifically emailing their providers, engaging with the patient portal in their health system, using video, making video calls. And also we are looking at their ability to make appointments with their doctors, their providers. We're also interested qualitatively in their experience with the program, and why they got engaged, and whether at the end they felt satisfied with what they learned. For the volunteer trainers, we are surveying them and interviewing them as well. We're just reaching out to them once, which is after their learner completes the program. We are focusing with them on the confidence again. Is there a change in their level of confidence teaching the key competencies that we are looking at with the learners? And then also their experience with the program and any recommendations they have for us going forward. Okay, next slide, please. So with regard to our baseline findings, we do have a group of older adults who have some of the risk factors that Josette mentioned as far as being a challenge to digital literacy. Almost 50% of our group had an education that was at or below high school level, and 60% of them had an annual income of less than $20,000 per year. The mean age of the group was 76. And we also learned from them at baseline that 16 of the 43 who have completed 16 of the 43 who were enrolled in the program missed medical appointments due to COVID-19. 13 of the group had not engaged in health-related activities online, and the reasons they gave for this was lack of technology, the expense, their lack of confidence doing so, their lack of knowledge, and for some of them, they hadn't wanted to. And then of the remaining 30, 14 of them had no or little confidence using their health system portal. So 27 of the 43 really had no confidence or experience using the internet for health-related activities when we started. And from our interviews, we learned that there was a variety of motivations to engage in the program, and there was some mixture emotionally. There was a lot of excitement and a desire to learn, and then there was also some fear of being left behind. And frequently mentioned participation goals were what we were targeting, so that was great to hear. They wanted to access their system portals, and they really wanted to, some of them really wanted to find reliable health information. And this one quote seems to kind of sum up that mixture. I'd like to be able to learn how to use the internet because everything is switching over to that, and I'm going to be stuck if I don't get to learn how. So now 31 of our older adults, 31 of our older adults have completed the program to date. 20 of them report using their patient portal to receive care. 15 of them have completed an advanced directive, a living trust or will since the program started. 28 of them are currently practicing telehealth and planning to continue using it. And of this 28, 6 of them were those who had no previous use online with health-related activities. We have also, in looking at the key competencies, seen a change in frequency of internet use. We did show an average increase of 10% across the board, but this was not statistically significant. And we think this is because we had such a range in change. So 13 people showed quite a large increase, 13 had no change, and 5 of them showed some decrease in usage. And this was really curious, and we are following up on this in our 3-month interviews. But one of the things that we have learned is that sometimes it's just due to external circumstances. People are coming out of COVID and they're able to engage with people again. And so one of the older adults was able to have her son come over and start helping her again. And so she just was not as interested in using the internet for health-related activities anymore because she had help. And then we also had some older adults who had significant health conditions. And this gets to Chris's point that, you know, things change and sometimes people can't engage with the internet the way they used to. And so their usage may drop. Thanks, Debbie. Regarding changing confidence. So we had great increase again on average, 12 to 24% for our 4 areas of focus. This was not statistically significant. And again, we think this is because we have this big range. Some people are feeling less confident, some are feeling the same, and others are showing great increase, which is why we have these high averages, right? But more than half of the older adults who have completed the program are reporting increased confidence in making video calls, accessing their patient portals, and in making healthcare appointments. And the emailing with healthcare providers is proving to be kind of interesting in the interviews. A lot of them are talking about that their providers aren't available. They don't respond to their emails in a timely way necessarily. For some of them, the email is actually being filtered through other people, which makes them uncomfortable. And so we think this may have something to do with the confidence levels decreasing. Also from our interviews, some of the themes that are coming through are just, again, these conflicting emotions. You know, there is a lot of emotion around this program, and there's tremendous gratitude. We're hearing all kinds of, you know, great stories about the engagement with the volunteer and the quality of the training and the patience that the volunteers are exhibiting. Real appreciation for the resources that they're getting. We're hearing a lot of stories about, you know, for those who really have engaged with the apps, they're now exercising daily, and they are using these meditation apps to help manage their own anxiety. And they're cooking, you know, they're learning to cook, and they're writing poetry, and they're now engaging in poetry groups online. And then there is also an appreciation. On more than one occasion, we've heard appreciation for that link to MedLink. Also the social connections. We had one woman who reported that as a result of Zoom, she was able to reconnect with her brother who has been living abroad, and that for the first time in 20 years, she saw his face last Christmas, and she was thrilled. We're also hearing that they do appreciate access to their providers for simple requests. So although they can be frustrated with trying to email about more complicated issues, that if they just have a simple request, they're finding that portal really helpful for them. There is frustration, and this is with both technology and the health system itself. With technology, there's, you know, the instability of connections. The passwords, as Debbie mentioned, can be an ongoing problem. And then also the way that devices are constantly changing. And this is something that I think all of us struggle with to some extent. And then with the health system, I've already mentioned a lot of it, but just this inconsistent availability of providers. And then also the health systems are changing their own infrastructure and software at times. And then if a patient changes their coverage and they know how to use one portal, the next portal will be completely different, and it may or may not work the same way. So there's just that constant need to adapt. And I think it just gets tiresome learning the same thing over and over again for some people. Okay, next slide, please. So these are some of the quotes we've had that reflect some of what we've learned. We had one of our super users learned how to get on Google, how to get on the App Store and load some of the programs. I learned how to Zoom officially with my doctor. I learned to order my prescription and look at things that interact with my medicine. And I started meal planning. Also, I learned to play Candy Crush. And then we also had a participant comment on the doctor situation. Well, again, like I say, I'm not getting a good response from the doctors, but I had to change doctors. So I'm hoping that it'll get better. And then we had some just really great questions. And I so wish the designers of these programs would really reach out to older adults, as Josette mentioned, that sometimes, why aren't they included? They really should be. But this was one of my favorites. If you've accidentally hit archive for one of your emails, where does it go? I can't figure it out. And I still don't know the answer to that question. And I don't know who does really. So yes, it just, the feedback has been terrific. With regard to the input we're getting from our volunteer trainers, so these are the survey results on the change in confidence training older adults in these key competencies we've been focused on: emailing providers, making video calls, searching for health information, accessing the patient portal, and then making appointments. And here we have shown statistically significant increases in the ability, in their confidence to do these trainings. Again, and this is on a scale of, I'm not at all confident to extremely confident. So we're really pleased that the trainers are so engaged in learning so much. And from the interviews with the trainers, we are again getting this, really emotional reaction, frustration with tech. The trainers are experiencing it as well. We heard a story from one who realized as she was working with the older adult that what she was seeing on her MacBook Pro doing the training was very different from what the older adult was seeing on their iPad. And so she was checking before each lesson on what it looked like, what the lesson looked like on the iPad. And so there was some learning there, again, frustration with the passwords. And then also with regard to the factual information and guiding the older adults to help them understand how to vet information. Explaining that when you do a Google search, the first things you see are ads. And so you want to scroll down to the bottom. And some of the volunteers were recommending that there just be a whole nother session on, vetting information on the internet and navigating it so that you can know what's advertising and what is quality information. We had feedback from the volunteers about the need for patience and letting the older adults guide the session. We really wanted them to be driven, as Debbie mentioned. It was really important in the lessons learned to find that balance between socializing and teaching and, having that quality engagement. Older adult education is very different than, working with kids. And so that was something that we're hearing. Also, with regard to the social aspect of it, there was just real gratitude and surprise and delight at how fun it was for a lot of the trainers. And also just real satisfaction when they saw their learners making strides and achieving what they wanted to. And here were some quotes we had. I felt myself getting a bit frustrated at one point and needing to work hard at regulating my tone. Going forward, I will work on staying patient so participant is clear that I am not frustrated with him. And with some patients, it is so wonderful to see the smile on the participant's face when something works on iPad. So the next steps for our evaluation, we're going to finish collecting the data from those who are just now completing the program, and then we'll be doing the 3-month follow-up. We'll finish all of that. And we're really excited to find out if we'll have any new findings or see changes from what we found so far with post-program, and how the older adults will continue to maintain their usage and confidence. So to wrap up the whole presentation, and then we can again take questions, we're getting a lot of appreciation. We're hearing about, just from both the older adults and the trainers, they're really grateful for this program. These programs are greatly needed, and they're really wanting to learn, and they have such great feedback on the technology. Why are they not being included in the technology design, and what can we do about this? I don't know that we're going to have an answer for that, but it is a question that is coming up. And Kathy, do you want to weigh in more on what you all are doing at Little Brothers Friends of the Elderly with regard to keeping this going?
Hi, everyone. Yes, as many, I think there's some community nonprofits on this call, you know that funding is always important to continue the programs. And so it's been really important for the funder that actually initially funded our Tech Allies 1.0. We kept that funder in the loop just to, to let them know that we are continuing the success of the Tech Allies 1.0 program, to show the success and the continuation of a program. I think relationships in your community are really important. We worked with UCSF GWEP on another project, and we kept, and it was a successful endeavor, and we kind of kept lines open, like, we got to work on another project together. What should we do? So I think keeping relationships and touches with your partners in the community is really important, because you don't know, like we never knew that Tech Allies during the pandemic was going to be a possibility, and it happened. So we were very grateful for our partnership with UCSF. And as an organization, we're a staff of 3. And so we're always looking for opportunities to engage our volunteers and using their skills, maybe like in their tech industry, because we are in San Francisco Bay Area, and to engage those volunteers to kind of do something different is very, very important.
Yeah, and just to kind of build on that, we are starting to think about what the next Tech Allies will look like. So just moving forward, we are going to complete these evaluations, as Alicia mentioned. And we knew that for the folks that participated and completed the Tech Allies for Health program, we wanted to keep them engaged. We wanted to keep them, wanted to make sure that they're still using their skills in Zoom. And so we decided to gather a small little group of it's Kathy, myself, and 2 volunteers who are helping put a bi-weekly newsletter to our older adults who have an email address. And we're really just doing different emails every 2 weeks, whether it be one about mental health, maybe one is about virtual events happening in the city. And that way they can really start to use their knowledge in Zoom and participate in more community activities virtually. And of course, we want to provide additional training for those older adults that do need it beyond the 7-session program. And so that's also something that's in the works of recruiting volunteers to kind of do just ongoing tech support, to troubleshoot any little issues that may come up that maybe I may not have the bandwidth to do, but we can get, like Kathy said, those volunteers with special skills in helping us with these things. And so there's a potential of working together to combine the Tech Allies for Health program with the initial Tech Allies 1.0 program, and making maybe a 15-session program and doing basic digital literacy training, along with teaching them how to connect with their doctors online. Of course, now that things are slowly opening up again, we do hope that we can offer this program in person again, but maybe even do a hybrid situation where it's in person and remote. Continue providing assistance to those older adults that aren't connected to the internet, helping them sign up for, again, that Comcast Internet Essentials program or AT&T's program. And of course, just working to get additional funding so that we can continue to purchase more iPads as well as learning materials moving forward to continue this program.
And we do an intergenerational program, and because of COVID, it became remote, and we were able to recruit people that participated in the Tech Allies Health program for this particular intergenerational program. That is a creative movement program in conjunction with the Global Health Institute. So always looking to see how we can build on the skills of our older adult learners in other capacities. So we always have that on in the back of our mind.
So I don't know if we want to now open up the floor for questions.
I see one from Amy asking, how were the volunteer trainers recruited?
Yeah, so I did reach out via email to all the volunteers that participated in the first digital literacy training program. And it was just to let them know, hey, we're launching this new Tech Allies for Health program, and just kind of explaining what that entails and if they were interested. So those that participated in the first one, they would let me know, hey, either, I'm too busy, I can't do it, or I am interested. When I got through all those volunteers, I just really sent mass emails, and we included them in our newsletters and all of that to really announce that this is a new program we're launching. It's going to start soon, and we do need volunteers. So it was just recruiting the volunteers we have in our database already, as well as just putting it out on our website and getting new volunteers that way.
Thanks, Debbie. You've sort of answered this by mentioning the newsletter, but the next question from Miranda is how are you encouraging users to stay engaged? She's implemented a pilot program called the Virtual Senior Center through self-help at their Office of Aging, but many users, despite being set up, aren't engaging.
Yeah, it's, we're trying this newsletter out. I want to say it's probably been a couple months now that we've started sending these bi-weekly newsletters out. It is also just kind of a hit or miss. I will say that not all of our older adults are interested in attending virtual events. But just to keep them engaged, we do offer, hey, now that you know how to use Zoom or you have Zoom capabilities, are you interested in maybe meeting virtually with your weekly volunteer caller? So just really finding different ways to use their skill set. Like Kathy mentioned, it's always in the back of our minds, whether it be for this, new program we have for creative movement, or I will occasionally take it upon myself to say, hey, can we meet via Zoom just so I can see your face? And just to kind of keep them practicing in hopes that once they build that full confidence with Zoom or whatever it may be, that they may be open to the next thing. So it's really just to be persistent in trying and explaining to them what a virtual event is, or what they may be able to see at these events, or really providing them with virtual opportunities that are of interest to them. We have one older adult who does weekly exercise classes, and we have another one who does cooking classes. So it's really dependent on what they're interested in.
So it sounds like, and we've also toyed with the idea of sort of booster sessions, and we haven't worked out the feasibility or the details of that, but talking about having sort of a formal booster session with the trainer to review things, answer questions, and so on and so forth. So there's a little bit more touches maybe in the year after. So we haven't really talked about that, but I know we've sort of bounced that idea around. Lisa asked, do you have plans to return to in-person training anytime soon?
Yeah, so as we are slowly inching our way back into in-person visits, that is something we are definitely looking forward to, especially our older adults. They may have completed the program and asked for an additional run through of the program, but in person to make sure they're doing it well. It's just a matter of making sure that the volunteers that do go to visit our older adults are fully vaccinated. So we're still waiting on some of those volunteers, and also just making sure that they follow our protocol and policy with in-person visiting, just for the safety of our older adults as well.
Thanks, Debbie. Lisa asks, is an iPad the product you would recommend for elders who need email, Facebook, and do they include voice to text processing?
We used iPads because that was just the first device we were able to get our hands on. I do know that some older adults do prefer Android devices, so I think it just really varies. I like to think that Apple devices are pretty user-friendly, but that's my bias because I only have Apple. Whereas Kathy has Android and she feels that's better, right? So it really does depend kind of what you're able to get your hands on. I do feel like iPads are a hit or miss simply because of those random updates you get, and then it could completely change the functionality of the iPad. But yeah, I would say that it's a good route to take. I feel it's easy enough.
We were pretty agnostic, to tell you the truth, about with our Tech Allies 1.0 what we were going to use, but we happened to there was a local nonprofit that had refurbished iPads from a private high school that we could purchase at a pretty low cost. So that's why we started with the iPad. I do think that there are some things to consider for other devices. A lot of companies will say this device will be great, but then there's hidden costs with the data plan. Mm-hmm. And so I think that's what we were very careful about in Tech Allies for Health and Tech Allies 1.0, that we didn't want any hidden costs with data plans for our older adults. So we were going to work with another company, but their data plan was really expensive. And after 3 months, we felt that wasn't something our older adults could afford. So those are some of the things you have to be considered. Go ahead, Deb.
Oh, and just to add on to the other part of your question,
yeah.
The first iPads our older adults received did not even have Siri capabilities, let alone any sort of voice dictation, anything. And so with this new one, they did have to learn Siri, and a lot of them loved it, that they could just even use, hey Google, to ask a question rather than typing it out. So in that sense, they didn't appreciate Siri as well as just voice to text.
And one from Chris, do you think there are any of your older adults who could become champions and peer advocates for this pilot, and they could have the train the trainers training too?
Right off the bat, I could think of two that absolutely. That would actually be really interesting to include them in the training, or maybe to even just talk about their experiences or best practices in their learning. Am I answering that question correctly? I'm sorry if not.
I think it's a great idea. Yeah. I think peer teaching can be extremely powerful and relatable. I think that's fantastic. Absolutely. I love that idea.
And I also can see that when we get back together and we have social gatherings again, have some of these adult learners talk about their experience in the Tech Allies for Health, and have them be the advocate, a peer advocate, and also provide training. And yeah, I think that's a great idea as well, because I think older adults like to see themselves as teachers, and we all do, right? So I think that's a wonderful idea. Thank you.
Any final questions or any other questions?
Did we want to try to circle back to Chris's question about the top three? Was it lessons that were, or the lessons that were harder or easier? Chris, can you type or? Okay.
Let me stop sharing my screen just so I could see everybody.
Says he can type, so maybe typing is happening. Do you
Okay,
see Chris's? Yeah.
yeah, so maybe we'll address Chris's question and move to Lynn. Did you see a top 3 issues that needed to be addressed when training? I think that means what were the top 3
Challenges?
Yeah, like in the content itself, maybe. What was the top 3 most challenging content to teach? Or
In the curriculum, perhaps?
oh, issues older people found. Sorry, thank you for the clarification.
Really just one of the biggest things was, the pace they have there was this fear of I'm not done with the curriculum and it's 7 sessions, what does that mean? And meant nothing. It's just you took the program at your pace and you can continue on with your volunteer, or I would even try to find a volunteer to step in. So I think the pace of the learning of the older adult, Wi-Fi, definitely. That was always the biggest issue. I mean, I can't stress that one enough to help people troubleshoot their Wi-Fi. And I myself am not a tech whiz in any way, shape, or form, but that was a big concern is why is my iPad suddenly not working? And trying to troubleshoot that and having to do 3-way calls with Comcast and the older adult there. Definitely was the biggest hiccup and that was kind of out of our control. Yes, definitely. I do agree that he said here that I could see peer advocates helping and address the pace and delivery of the training. Absolutely. And just to hit your point earlier on, it's great that you even mentioned to have a champion, basically, peer advocate, because again, that's something we did not consider, but it kind of goes hand in hand with the design of a program or the design of an app. So definitely want to do that moving forward, or even just have I do want to do like a Zoom session with all the trainers and volunteers to be able to understand what worked, what didn't work, how can we make the program better moving forward, and a space for them to share their experiences as a group. And my last top issue, it's just the scheduling conflicts is out of our control. We wanted, again, this program to be 7 sessions kind of on a consistent basis, but that was not the case. And that was just something that wasn't in our control and we had to just work with it. Hope I answered.
I think so, Debbie, thank you. So Chris responded, we are piloting a health literacy plan here at Honor Health in Arizona with Amy, and we are excited to run the patient advocacy component to keep us on the right track for service design and delivery. I'm excited to learn more and hope to hear about that, Chris and Amy. I think this is, again, I think this is an emerging area and there's a lot of work to be done. And, I hope we can keep sharing in some kind of forum. Lynn had a question. What organizations did you approach to fund the iPads?
Thanks, Lynn, for that question. Of course, we went to some of the high-tech companies in the Bay Area for Tech Allies 1.0 and Tech Allies for Health. And to be quite honest, just for devices or additional funding for the curriculum, they weren't interested in helping us. So we went to the funders who have already funded our program, various grantors various family foundations that fund us. And then we also did campaign to our individuals that get that donate to us on a regular basis. So we did an email campaign and a letter writing campaign as well. But high tech, for many who can guess the reasons, really weren't interested in funding the program. And we had some pretty high level talks at Google and Apple, but they kind of went nowhere fast. So I think your funders that already fund you, you tell the story, they understand your mission, they know that you deliver the programs, and just having conversations with folks that already fund you is the best idea.
I also want to answer Lisa's question. With in-person training, any luck using mobile phones as internet hotspots? So in person, definitely there were volunteers who would offer to use their personal hotspots, though we did not recommend it. Of course, in order to participate in the Tech Allies program, we did have to make sure they had some sort of connection beforehand. Of course, if they had weak connection, then the volunteer would use their hotspots. And then we did have, at least for the Tech Allies 1.0 program, we were able to get 2 different hotspots that we were able to lend to the older adults who may not be eligible for internet essentials and could not afford to pay whatever the price was for internet connection in their home. So then we would temporarily let them use this hotspot device until we can find a way to connect them moving forward.
Thanks, Debbie. The reason I asked that is because we're going to be at the Gerontology Institute at the college trying to roll out something like this in the next year. And I picture that internet access is going to be a barrier for some people. So that's why I wondered. Can I ask you one more question? If you were doing this in person, would you ever consider doing it with a group of older adults, and how big could that group be for it to really be effective?
Yeah, so we steered away from the group situations solely because, maybe we had homebound older adults who wanted to do the program. So that's why this program was unique, to bring it to their homes where they're comfortable and they're not stressed out like, oh, I'm not learning as quickly as that person. I don't even know what that means, but I don't want to stop the class. So that's where it was where it was unique to do one-on-one. But I would say if we ever did do a group thing, maybe no more than 4 to 5 older adults at a time, just so that everyone can equally have the trainer's attention if they have any questions, and to just not feel overwhelmed. Or, we also got feedback, oh, I'm too dumb to learn this, or, I can't learn that fast. And that's not the case. We want to make sure everybody's needs are met and meet them where they're at.
And we don't really have a center. So we have an office. So we don't really have a center because all the programs are delivered in someone's home. And our average age of our older adults in our program is about 84 years old. And so those are for folks that maybe no longer can go to that senior center because they can't get down the stairs, they can't get down the hills in San Francisco. So we're dealing with a population that may not even go to a senior center or the library anymore because of mobility issues and transportation issues that many of our older adults face throughout the United States. So we just feel like the in-home model just works for the folks that we do serve.
Mm-hmm. But if you do have a center, then I still would stick to the 4 to 5 number to make sure that everyone's getting the most out of their sessions. Any other questions?
Thank you, Chris.
Maybe we'll leave it there.
Yeah.
We can if there's no other questions from people. Give it another minute. I want to thank you all so much. This is so informative and helpful. And thank you to Kathy for coming on. I didn't know you were going to be here, and it was great to hear. Interesting to me that it's all in-home stuff that you do. Makes a lot of sense for the population you're talking about, for sure. Thanks to everybody who joined us today for our last. It feels like the series has been going on for a while because we did 3 and then we had a little break and then we did 3 more, but we're wrapping up our program year and our fiscal year like a lot of people in academia, so it's been a little crazy. It sounds like the presenters are happy to share their slides, so we're going to send those around, and we've also recorded this. We'll need, you know, probably a week or 2 to get things sorted and get it up on our YouTube channel and onto our website, but if you feel free to share it with others, we'll let you know when that's up. And any last words from you San Francisco people?
Thank
We
you.
look forward.
Yeah,
We look-
thank you. Thank you so much. And, you know, again, there's so much work to be done and so much advocacy to be done for internet access and affordability and for bringing up the digital literacy skills for a lot of populations. We're talking about older adults here, but, you know, for them in particular. So we're excited about the work and hope that you all engage in some way, shape, or form. And we're happy to connect offline or serve as a resource if we can help in any way. Let us know.
Super. It
Oh.
looks like, I'm sorry, go ahead, Kathy.
No.
I just see someone's put in the chat some stuff about libraries and apps, and we're trying to do more partnering with especially rural libraries where we are to bring programs. So thanks for sharing that stuff, Jennifer.
Yeah, that looks like great information. I'm cutting and pasting it right now.
Yeah, I'm going to do the same, Lisa Kendall, who just asked if we could share these resources. I'll also save the chat.
And Lisa, we look forward to hearing how your program goes.
Yeah, it's going to be really interesting. We're meeting with the Community Tech Network people next week and figuring out how we're going to do this. So it's going to be, I think it's going to be great. And this is so helpful for us to learn how you did it, what your pitfalls were. You know, I don't think we really have the manpower to do an evaluation like you did. I mean, we'll see, but it would be nice to be able to at least survey people and see, you know, afterwards and see how it went.
Well, I'm happy to share any of the instruments, you know, what
Okay.
anything that you're interested in even looking at, happy to do that.
Super. So any last thoughts? Are we good? Barbara Gansell is our director of the Gerontology Institute, and she's thanking you all from all of us at the Institute for this final session in our health literacy series.